Hello, Dr. Childress here. I'm a clinical psychologist. Welcome through my walk and my stroll through Gardner's 8 symptoms of parental alienation. We've gone through the first 3 symptoms. First were 2 terrifying symptoms. The third approached the realm of okay, and provided some information if we tweak it a little bit. Okay, so I'm optimistic now. Symptom number 4. Give me symptom number 4. The child strongly asserts that the reason for the rejection is theirs alone, that they're not being influenced. And Gardner calls that the independent thinker phenomenon. Oh, and I was getting so hopeful. That is the worst thing I have ever heard. That is the worst thing I have ever heard. Clinical psychologists are not allowed to override the independent autonomy of another human being. It's not up to me to decide your attitudes and beliefs are not your own. If they tell me their attitudes and beliefs are their own, that's their belief. And of course they're going to say that. That's not a symptom of pathology. I bet you believe your attitudes aren't being influenced by other people. I think we all believe we make our own decisions and we're not being controlled by other people. That's not a symptom of pathology. Oh, dare I ask, how would you operationalize that? What are the scales or things? Now, over in ADHD, remember, for the diagnostic criteria, they operationalize often with something like the Connors scale, where there's 95th percentile on a behavior rating scale, then that often symptoms are present. Okay, and so that's what the Connors does. It's okay. Autism, we have the CARS, we have other diagnostic indicator things operationally defined for what this symptom is. Independent thinker phenomena. Let me hear it. What's your operational definition? There is none. Why doesn't that surprise me? Okay. So you have no definition for this. So your first 2 symptoms and your 4th symptom, people can just make up whatever they want. They can say it's there. They can say it's not there. I'm not even talking about what the truth of your symptoms, whether or not they're even true or not. We haven't even reached that point. We're just talking about a diagnostic model. As clinical psychologists, I can kind of decide it's there, it's not there. There's really no criteria for anything. It's just kind of general ballpark kinds of stuff that, it isn't really related to anything else. None of these symptoms are from oppositional defiant disorder or conduct disorder or ADHD or pretty much anything else, depression, anxiety. There's no reference to any established kind of symptoms. So not even anxiety or depression. It's not even anger. It's not even anger. It's a campaign of denigration. There's no grounding in and we're halfway through your symptoms. And you throw this just an absolute haymaker. The independent thinker phenomenon. I think that's the most ridiculous thing I've ever heard. As a diagnostic indicator, you go and ask somebody, just walk up to some random person on the street and say, are you being influenced by other people, or do you believe what you actually believe is yours? I bet you 98% of the people are going to show that symptom. They're going to say, no, I'm not being influenced. I'm actually experience what I feel. The other 2% are schizophrenics who have a delusional disorder of possession and control, thought insertion and stuff. No, it's not me, it's the aliens. But the other 98% of us are going to have symptom 4 of Gardnerian PAS. That is, it's not only the absence of any criteria for how many symptoms need to be present. 5 out of the 8, 3 out of the 8, 1 out of the 8. Does 1 out of the 8 mean it could be parental alienation? Well, not likely, but it could. Well, possibly. So just having one out of the 8 symptoms, it could be. Besides all that misunderstanding or conceptual disorganization around the very concept of diagnosis, if your diagnostic indicator does not discriminate between 2 groups, it's bad. When 98% of the population have your diagnostic indicator, that's not a good diagnostic indicator. So if we toss out 1, if we toss out 2, we toss out 4, we have to tweak 3, so we have the child shows splitting. So let's just go with that one. We got trauma, potential narcissistic borderline. Ooh, we got all sorts of stuff. If we got surrounding divorce, we have the potential abandonment stuff. Oh, you know what? Thanks, I can work it out from here. Okay, if we got splitting in the child, thanks for your model. Really appreciate talking to you. I'll work it out from the borderline side of things. Okay, and we got it, because that's going to be a disorganized attachment and an anxious insecure, and then we got narcissist on this too. Okay, yeah, all right. So got it. Thanks so much. But I'm a clinical psychologist. I gotta hear it out. Let's go to the end. This is my first encounter with Gardner PAS. Let's go to symptom